Good afternoon. My name is Joe Chiani. I'm CEO of Masimo and founder of the Patient Safety Movement Foundation. We lose over 200,000 people a year from preventable causes in our hospitals in the US every year. That's equivalent to 2 jumbo jets crashing and killing everybody on board on a daily basis. We're losing over 3 million people globally. And when you think about one life, one of our loved ones' life, and you see what a tragedy it is, and then on top of it, you realize that the solutions to these preventable causes are there. We don't need new R&D. We don't need FDA approval. We just need to implement them. It becomes a moral imperative to do something about it. Well, with the help of President Clinton, we started the Patient Safety Movement Foundation with the goal of 0 preventable deaths by 2020. We gathered the partners from clinical side, medical technology side, patient advocate side. We created recipes, 6 of them, to these problems. And I'm happy to tell you that they're being implemented and that we're going to do something about it. Preventable death should not happen. And when you think about the goal of the new millennium, should not be just access to health care. It should be access to health care that guarantees patient safety and patient dignity. I know President Clinton's talk at DNC gave President Obama a 5% bump, but him helping us with the patient safety movement has given that a much, much bigger bump. I hope that you will join us and help make preventable death an end to it, 0 by 2020. Thank you.
Good afternoon. I'm Nancy Ossie, President and CEO of International Medical Corps. Who's our best hope in any disaster? A disaster like Somalia or Syria or Haiti or the Congo. Local people are. And that's what we've learned over the last 30 years in 70 countries, working with those who are truly our world's hardest hit. Our commitment, first responders, a new approach to resilience, builds self-reliance, and gives 600,000 men, women, and children in Africa the tools, the skills, and the training to prevent, prepare for, and respond to emergencies. This way, these people in these dire disaster situations can become their own best first responders. Thank you.
Good afternoon. In China, many children in a rural area suffer from malnutrition because being far away from home and very often from their parents, they live on basic and inadequate meals, such as a monotonous diet of soybean and rice, and they have that for years. A simple school kitchen with refrigerator and steaming cabinet can make possible hot meals with vegetables, meat, eggs. We have piloted such kitchens with success. Our commitment is to build another 2,000 kitchens in the next 2 years, which will benefit 1 million rural children. We also educate kitchen staff and families about proper nutrition, create demand for local farmers, and put to good use local government's school feeding budget. This program, which we call the Spring Sprout Kitchen Program, addresses rural malnutrition in a sustainable way. I am Audie Wong, President of Amway China and Vice Chairman of the Amway Charity Foundation. Thank you.
Good afternoon. I'm Michael Murphy, the Executive Director of Mass Design Group. Diarrheal disease is the #1 killer of children and the #2 killer of adults in Haiti. 1/3 of the world's population will suffer from diarrheal disease in their lifetime. This is a crime, especially because we figured out how to solve this problem in the 19th century by inserting into our cities waste and water infrastructure. But we know today that's not quite possible. Together with our Haitian NGO partners, La Centre Gestion, we've developed a new prototype to this problem. we're developing Port-au-Prince's first Center for Diarrheal Disease, and we're building it in Port-au-Prince. This center is unique for 3 reasons. First, it cleans water and it distributes it. Second, it provides primary health care. But third, and possibly most importantly, it collects and decontaminates waste on site, locally, in the community that it's serving. Our commitment this year is to replicate this center 10 times over through Port-au-Prince. We think we can provide, by doing this with our partners, we can have 28% of the population of Port-au-Prince which has access to sanitation increase to 75% by 2020. Thank you. But I need your help. I need all of your help to help us achieve this commitment. We need more 21st century solutions to 19th century problems. Thank you very much.